I'm very happy to be here today because the ultimate goal of today's talk is that every citizen and legal resident of California has healthcare coverage. The purpose of today's talk is to inform you all about Covered California, to inform you more about the Affordable Care Act and how it relates to Covered California. Now, I do have a big ask at the end of this talk. What I really want you to do after you've learned what you've learned today is go and talk to other clinicians, talk to your staff, and talk to your patients about what Covered California is all about. I'd even go so far as to say in your social life when you're at different when you're with different groups of friends to actually bring up Covered California and talk about it. So many of us have friends and relatives who will benefit from getting on Covered California and getting their health care coverage. So at the end of this, I really want you to go and talk to other people about what you've learned today. This is me. I'm the president of the California Academy of Family Physicians. I have also worked in residency education for 15 years, and I currently work at an FQHC, a federally qualified health center, for the last 4 years, and so I certainly know about the population that will need to be using Covered California. This talk is sponsored by a grant that was given to 4 organizations, ourselves, the California Academy of Family Physicians, the California Academy of Physician Assistants, the California chapter of the American College of Physicians, and the Osteopathic Physicians and Surgeons of California. Now, I've already said what my ask is. My learning objectives at the end of the session, you should be able to summarize the major components of the Affordable Care Act, outline the goals of Covered California, identify target populations for Covered California and their area, and convey to both office staff and patients the basics of Covered California: who is eligible, what are the basic coverage options, and how to get started. So I certainly hope that at the end of this half hour, you know a lot more about Covered California than you do at this moment. Now, why are we doing this? We surveyed 1,000 members of the 4 organizations, and about 16% of the members said that they were only moderately or highly knowledgeable about Covered California. They said that about the same numbers for their staff as well. About 62% said they would like to be highly knowledgeable about Covered California, and more or less it was the same number for clinicians and staff. So there's a large gap in knowledge about Covered California, and we're here to fill that gap. We also ask about how you would most likely want to learn about Covered California, and the overwhelmingly majority of you picked on-demand webinars as a way to learn about it, and as well as handouts and fact sheets. So this webinar is here for you today, so whenever you need to look at it or go back and review or refer someone, you'll have the information at your fingertips. Now, as an overview of the Affordable Care Act, as we all know, it passed in 2010. And some of the major components of it are, number one, that you can no longer be denied insurance due to pre-existing conditions. There's a requirement that almost everyone needs to enroll for insurance. There's the creation of the exchange or the marketplace where people will be able to easily purchase an insurance plan. And probably one of the biggest components is the expansion of Medi-Cal/Medicaid, premium assistance, and cost sharing. And we'll be spending a lot of time later in this talk talking about those 3 aspects of the Affordable Care Act. This talks about some of the changes that have already taken place. Now, as of January of 2014, one will be required to have health insurance. But prior to January 2014, a lot of things have already been enacted. This shows a list of those things, and I just want to highlight a few. Number 1 would be young adult coverage, that up to age 26 you can stay on your parents' insurance plan. Also, there's no longer lifetime or annual limits to what an insurance will pay for certain conditions, and also the ban on pre-existing conditions, making it so you can no longer get insurance. So I just want to highlight those 3, but many things have already taken place before January 2014. Now, as I said, beginning January 2014, everyone's required to have health insurance. Parents with children are also required to buy health insurance for their dependents. And this is a really important part of the whole Affordable Care Act, because if everyone does not pay for insurance, if everyone does not put money into the whole pool, we're not going to be able to take care of each other. So younger or healthier people will be putting money into the pool to take care of people who are sicker, but they also will then have the opportunity to assess medical care if they need it. So it's very, very important that everybody gets into the insurance pool. So this is a little bit redundant, but again, the Affordable Care Act expands Medicaid and creates new premium assistance and cost-sharing reduction programs. I'm going to be mentioning those so many times because it's such an important component, especially as it relates to getting on to covered California. There will be a single streamlined application process and a no wrong door approach. So if you are making low enough income that you're eligible for Medicare, you're going to be told that that should be the way that you attain your health care is through Medi-Cal and not through the Affordable Care Act, getting on covered California and getting your insurance that way. There are some people who will not be required to have health insurance, and some of those are highlighted here. There's certain religious exemptions. If you're experiencing temporary financial hardship and can prove that, you will not be required to get health insurance. If you're making less than the limit that you need to file income tax, and that would be $10,000 for single people or $20,000 for a family, you would not be required to purchase insurance. And probably the biggest population that is not going to be required are the undocumented. So the undocumented with the Affordable Care Act, they get no benefits, but at the same time, they're not required to buy insurance. They totally fall under the radar here. So if you're taking care of a lot of undocumented patients, Covered California Affordable Care Act does not apply to them at all, unfortunately. Other people that do not need to apply are Indian tribes and incarcerated people, although when you're incarcerated, you get fairly good health care. Now, if you do not buy insurance, you will be fined, and this lists the fines that go up each year. So starting the first year, you will be fined $95 per adult and $47.50 per child, or 1% of your income above that tax filing threshold, which, as I mentioned, was $10,000 for an individual. Whichever is higher, you will be fined during the first year if you do not purchase health care. That's not a very big fine, but by the second year, it starts going up $325 per adult and $162.50 per child, or 2% of your income above the tax filing threshold. By the third year, 2016, it's $695 per adult, $347.50 per child, or 2.5% of your income above the tax filing threshold. By the third year, certainly it really starts making much more sense that instead of throwing away your money for a fine, that you actually purchase health care. So keep this in mind. I think the big struggle for us will be that first year when the fines are not very high, but they really go up quite a bit the second and third year. Now, one of the big components of the Affordable Care Act is Medi-Cal expansion, Medicaid expansion. And if you make 138% of the federal poverty level, you will be eligible for the Medicaid expansion, signing up for Medi-Cal. And the big expansion is it used to be 133%, and now it's up to 138%. So there's about 1.4 million people in California who will be eligible for Medi-Cal expansion. The other big component of that is the federal government will be paying 100% of that for the first 2 years, and that will go down, but the federal government will never be paying less than 90% of the cost of insuring these additional adults in the Medicaid expansion. The state would only be responsible for 10% of the cost. It's really quite a good deal, and we're very lucky in California that we took this good deal for the Medi-Cal expansion. At least about half the states have not actually applied for the Medicaid expansion. On this slide, I just want to point out the first column where it says 100%. look under there, and this tells you what the federal poverty level is. So when we talk about 138% of the federal poverty level for a single person, it would be at $11,490. That's what the federal poverty level is. Just as a quick aside, I think it's important to let you know, how is the federal poverty level determined? This was back in the early 1960s. It was determined that food is about a third of your budget, and they figured out what foods would be in that budget that a typical family would buy back in the early 1960s. And then they multiplied that by 3. And that's how the federal poverty level is determined. It's still determined that way. It's redecided every year looking at inflation. But when you look at the income right now of people in families' budgets, about a sixth of their income actually goes towards food. So there's a lot of controversy about the federal poverty level to begin with. I just want to tell you that because when you look at these numbers, you may be kind of shocked of what the threshold is, and maybe that it should be quite high. But this is what it is at this time. Other improvements in Medicaid/Medi-Cal, other than expanding the amount of people who can be on the roll, are listed here. But the big one to highlight is you do not have to have children living with you at home. In the past, for most people, if you had a child at home, you would be eligible for Medi-Cal. But once the child left the home, you would no longer be eligible. So a lot of younger people or single people were not eligible for Medi-Cal, and they are now eligible. And that's a really nice change. So what is Covered California itself? Covered California is our state's marketplace for purchasing a healthcare plan. The nation has a national healthcare exchange, but in California, we've created our own healthcare exchange. This will also be the exchange where small businesses will be able to buy insurance for their employees. And this is small businesses that have 50 or less employees. Covered California is, if you get on the website, will help determine what level of plan would be good for you and then give you your plan options. So Covered California specifically is the exchange where you buy your insurance plan. Now this of course will be for people who make more than 138% of the federal poverty level. Anyone after that, anyone who makes less than 138% of the federal poverty level, they will be going on Medi-Cal, and that's the way you should get your health care. Covered California, I'm going to read this word for word. The vision of Covered California is to improve the health care of all Californians by assuring their access to affordable, high-quality care. Covered California's mission is to increase the number of insured Californians, improve health care quality, lower costs, and reduce health disparities through an innovative, competitive marketplace that empowers consumers/patients to choose the health plan and providers that give them the best value. And I think it's important to know what the vision and mission is, because that's where we're all here today, to fulfill this vision and mission. The primary population for Covered California, there are about 5.3 million uninsured Californians at this point. As I said before, if you are below 138% of the federal poverty level, you should be getting on Medi-Cal. You are not the target population for Covered California. You will be getting your health care through Medi-Cal. If you are 139% of the federal poverty level, up to 400% of the federal poverty level, you should be getting your health care on Covered California. And if you're 400% or below, you will be eligible for different subsidies. So it's very important to get your health care that way, because you will get a less expensive plan with subsidies. If you make more than 400% of the federal poverty level, this is still where you should buy your health care, because it will be less expensive than if you went out into the private market, although you will not get any subsidies. This is also where employers with 50 employees or less would be purchasing healthcare plans. Now, about 2.6 million Californians are going to be eligible for Covered California and get the subsidies. And this chart represents the different ethnicities of people who will be eligible for Covered California with subsidies, that 2.6 million people. Now, as you can see, Latinos are a large portion of that, many of them Spanish speaking. So the Covered California website will be in English and in Spanish, although we'll need to have many other languages. The Covered California website will only be Spanish and English. I'd like to mention here also that the occupations that are going to be high on the list of people who are eligible for Covered California. The three largest occupations are actually adult students, people who work in construction, and people who work in the food service industry. So when you're looking at your patients, these are the ethnicities, and the occupations that will most likely be targeted will be the adult students, the construction workers, food service workers. And some other things are if you're involved in crop production, landscape, and also household employees are also in that group. So keep in mind those occupations and the ethnicities. This also shows the geographic mix. I just want you to look at Southern California. Los Angeles has 780,000 people who are eligible for Covered California. The rest of Southern California, San Bernardino, Riverside, Orange, and San Diego also have about 750,000. So the lion's share of the people who are going to be eligible for Covered California is going to be in Southern California. These are all the languages that are going to be need to be covered. So if you speak something other than Spanish or English, you would need to use the phone numbers to talk to somebody who speaks in those languages in order to determine what insurance plan you're going to have. And these are so many of the major languages that are going to need to be covered. So who is eligible to enroll? As I've said earlier, citizens of the state or legal residents who have been here for at least 5 years. If you're incarcerated, you're not going to need to enroll. And you need to be a resident of the state. If you're a resident of another state, despite being eligible in every other way, you will not be able to buy your insurance in Covered California because you're not a California state resident. And I want to emphasize once again that if you are undocumented, you are not required to get insurance, and you totally fall under the radar. You get no coverage. So what are the services that are offered under Covered California? And I'm going to get into a lot more detail right now. So you'll have many insurance plans to choose from, but you will also be possibly eligible for premium assistance and cost sharing reductions. Premium assistance is for people who make 139% to 250% of the federal poverty level. These people will get assistance on their monthly premium. So premium assistance refers to what you pay each month for your health insurance plan. And if you make below 250% of the federal poverty level, you will be eligible for premium assistance. Cost sharing reduction refers to the out-of-pocket expenses that you might incur with your health insurance. So these are things like co-payments or co-insurance. And co-insurance meaning, let's say the doctor charges or the clinician charges $100 for a visit. Your insurance will pay 80%, but your co-insurance, your co-payment would be 20%. Cost sharing reductions refers to a decrease in that. So if you make between 250% and 400% of the federal poverty level, you will not be eligible for premium assistance. Yes, you are eligible for premium assistance, but you would not get the cost sharing reductions. The cost sharing reductions are just for people below 250% of the federal poverty level. We're going to very shortly talk about the metal tiers of the plans. And if you are buying a plan where you need the cost sharing reductions, you make less than 250% of the federal poverty level, to get the cost sharing reductions, that assistance in the out-of-pocket expenses, you have to buy within the silver plan. And we'll talk about that in a minute. This is probably the most important slide in the whole set because it's really the big schema where everything fits in. So it's worth a review. And then everything else I've talked about today are just the details within each pathway here. Path 1, again, are for those people who make less than 138% of the federal poverty level. Their path to getting healthcare coverage is through Medi-Cal. Covered California is not for them. Path 2 is for people who make less than 400% of the federal poverty level. That's broken into two groups again. The first group would be 139 to 250% of the federal poverty level. These people will be eligible for premium assistance as well as the cost sharing reductions, which I just talked about. If you make 251 to 400% of the federal poverty level, you will not be eligible for cost sharing reductions. You do not get help on your out-of-pocket expenses, but you do get help with your premiums that you need to pay each month. Path 3 is if you make greater than 400% of the federal poverty level, you can buy your health care on Covered California at a a more inexpensive rate than you would privately, but there will be no financial assistance, no subsidies at all. So it's still actually a really great deal to get your care on Covered California. Now, one of the reasons that's true is every health plan will be required to have essential health benefits. So that way, whatever insurance plan you're going to buy, there are many components that will be exactly the same. So now you're comparing apples to apples. Before, different insurance plans can offer some benefits and maybe not other benefits, but within Covered California, every single insurance plan has essential health benefits. I'm not going to enumerate those, but they're listed here. And so that way, if you're going to purchase, let's say, Kaiser or Molina or whatever is going to be offered through the exchange, the benefits will be the same, and then you have to look at other things to make your decision on what plan you're going to buy. Now let's talk about the metal tiers for a minute. When you get on Covered California, you'll have a choice of choosing a tier: bronze, silver, gold, or platinum. What is the difference? If you buy a bronze plan will have very low monthly premiums, but if you use your health care, you will have high out-of-pocket expenses. Your co-payments and your co-insurance will be much higher. If you go to a platinum plan, you will have much higher monthly premiums, but if you have to use your insurance, your out-of-pocket expenses will be much less, your co-payments and your co-insurance. So if you look at the bronze plan, if you're someone if you're young, you're healthy, you're thinking you're not going to have much contact with the healthcare system, this might be the plan for you because you will have a low monthly premium, and only if you use your insurance will you have to pay a higher amount. If you're someone who's maybe going to be having a lot of contact with the healthcare system, the platinum plan might be for you, because even though you may be putting out a lot of money out front, when you actually have to utilize the healthcare system, your out-of-pocket expenses will be much lower. This shows you what happens with the bronze, silver, gold, and platinum, and what percentage the health plan would pay and what percentage you would pay. Again, if you are of that group that makes less than 250% of the federal poverty level and will be eligible for cost-sharing reductions, you must buy your plan within the silver tier, and I'll get into that in a little bit more detail. This slide we saw once before, but I want to call your attention to the bottom line where it talks about 94% coverage, 87% coverage, and so on. This refers to the cost-sharing reductions of the plans within the silver tier if you make less than 250% of the federal poverty level. So, for example, if you make 100 to 150% of the federal poverty level, you will actually get 94% coverage of your out-of-pocket costs. Your insurance will pay 94% of your out-of-pocket costs, and you'll only be responsible for 6% of those costs. As you go up closer to 250%, you have less and less coverage by the insurance, but you still get assistance with your out-of-pocket expenses. Once you get to 250% of the federal poverty level, again, you will get the premium assistance, but you no longer would be getting that cost-sharing reduction. And on the silver level, that would be 70%. So your health insurance would pay 70% of your out-of-pocket expenses. You'll be eligible for 30%. So I hope that makes sense, but this is where you would want to go. Less than 250%, the federal poverty level, you go to the silver tier, and then you'll have various plans to choose from, but they'll all offer the same assistance as far as cost sharing goes. Now, the other way that Covered California divides up the healthcare into geographic regions, there are 19 geographic regions in California. Every region has different set of health plans available for you to purchase within that region, and the prices will differ region to region. So when you do put your data into Covered California to see where you would fit in, putting in your zip code is very important because things will differ from depending where you live. Just to emphasize one more time, the most salient features to take home today from getting onto Covered California is who is not eligible for Covered California, that Medi-Cal population, less than 138% of the federal poverty level, and then for people between 139 and 400%, get on Covered California, you get the premium assistance, and if you're less than 250%, you'll get that cost sharing reduction. This has come up many times. It's just to sear that in your memory, so when you talk to people about Covered California, you understand these concepts. Now, open enrollment generally will be only once a year. It will be October through December every year. This first go round, it will be 6 months. So it will start October, it's already started October of 2013, and it will go all the way to March of 2014. Now keep in mind though, that you're going to be required legally to have health insurance by January of 2014. When you buy your insurance plan on Covered California, it will go into effect. You have to buy your insurance between the 15th of the month, and then it will go into effect by the 1st of the next month. If you buy your healthcare plan after the 15th of the month, it does not go into effect until 2 months later. So if you buy your plan on December 14th, it will go into effect on January 1st, 2014. If you buy your plan on December 17th, your plan will not go into effect until February 1st of 2014. So whenever you buy your plan, you would need to do it before the 15th of the month in order to have your plan go into effect by the 1st of the next month. So how can you enroll? You can enroll, number one, by the website. And again, the website is both in English and in Spanish. If you speak one of the other languages, you have the phone numbers here that you can call to make contact with people from Covered California who can then help you in that language. Remember that this is the only website to go on to purchase your plan from Covered California. I imagine there's going to be a lot of kind of fake websites and stuff, and you need to be very, very clear that this is the only website that you go on to purchase your plan. So how does it work? Individuals and families would apply through Covered California. You would put your necessary data in that I will tell you in just a second, and the Covered California site would then tell you what you're eligible for. So just to highlight some of the big advantages of the Affordable Care Act and Covered California, it's very affordable with premium assistance. It takes care of high out-of-pocket expenses with the cost-sharing reductions. There's the benefit limitations, so there's the essential health benefits that are there in every plan. And this makes it so it's not confusing to try to pick your insurance plan. You know what you're going to be getting, at least the minimum within each plan. And there can be no coverage denial based on pre-existing conditions, which is finally a wonderful change in our health insurance system. Again, this is the official website. You'll see this photo in the first page of the website. And I think places like AOL, they've been advertising Covered California, and on AOL, this is actually one of the first scenes that you see. When you get on the website, there's going to be basic information that you need. You will need to put in the number of people in your household, the age of each person, your household income, and also your zip code. And then Covered California will tell you what you're eligible for. And I've tried this myself, and I've put in a very, very low income, and they do tell you if you're less than 138% of the federal poverty level, that really Medi-Cal is the way to go. I've also put in my real income, which has told me that I'm not eligible for any subsidies at all, but that I can purchase my insurance there for a lower cost than I would if I was going in the outside market. And then from there, you go on and choose which metal tier plan level you're looking for. And then within each metal tier would then be the various plans you can choose. So again, how do you enroll? Here's again the website. Here's again the phone numbers. Now, all this is going to be very closely regulated. The next series of slides just proves that it will be closely regulated. These are the two organizations who will be the regulating agencies. These are the kind of things they're going to be looking at to make sure that everything is compliant. So what can you expect from us, the four organizations that will be helping clinicians learn more about Covered California? You would expect from us frequent and respectful communication. We'll have many live educational activities. We have the online educational activities, such as this webinar, where we will be designing education design for your team and your office staff, and there will be a website with many tools that you can use to learn more about Covered California. So I hope this has been very beneficial to you. Please go out and spread the word. I think I've broken it down in a very simple way. And I would urge you perhaps to get on the Covered California site, plug in your data, and just get an idea of what it's like. So when you do talk to patients, talk to your staff, or talk to people in your social life, you really understand not only didactically, as I've taught you, how Covered California is, but also in a practical way. So thank you very much for listening to this. Please contact us if you have any questions about anything. The email contact numbers are down here, and we'll get back to you as soon as we can. Thank you very much.